What is autism spectrum disorder? What is the definition, prevalence, and diagnostic criteria for autism spectrum disorders? What is the best practice intervention for children with autism spectrum disorders? The important role early childhood education professionals have in providing an inclusive classroom and assisting early intervention. That will be the learning objectives for the first module, What is autism spectrum disorder? So, autism spectrum disorder is a term for a group of lifelong neurodevelopmental disorders. These disorders are characterized by varying degrees of difficulty in social interaction, verbal and nonverbal communication, and restricted and repetitive interests and behaviors. Autism spectrum disorders include diagnoses previously described as autistic disorder, Asperger's disorder, childhood disintegrative disorder, and pervasive neurodevelopmental disorder not otherwise specified. In 2012, there was an estimated 115,400 Australians living with an autism spectrum disorder. This was a 79% increase from the estimated 64,400 in 2009. Within the Australian states currently providing the National Disability Insurance Scheme, 30% of participants have been identified with ASD, which is the largest single disability category in the whole scheme. In the 1960s to 1970s, research surveys reported the prevalence of ASD to be between 0.7 to 4.9 cases per 10,000 children. In 2012, the Australian Bureau of Statistics reported 115,000 Australians living with ASD. However, this is before the newest edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, which determines a diagnosis of ASD, in which significant changes was made to the diagnostic criteria and labeling of ASD, making it difficult to determine the prevalence of ASD over time. The fifth edition of the DSM-5 determines the diagnostic criteria for autism spectrum disorder as of May 2013. To be diagnosed with ASD, the symptoms must be present from early childhood, including deficits in two main areas: social communication and interaction, and restricted and repetitive patterns of behavior, interests, or activities. The reference to the word spectrum in ASD is due to the varying degree of difficulties of each individual with a diagnosis. The DSM-5 classifies the severity level of ASD from level 3 to 1, 3 being the most severe, requiring very substantial support, level 2 requiring substantial support, and level 1 just requiring support in the areas of social communication and restricted repetitive behaviors. Best practice interventions for ASD include early intervention, which is provided to children between the years of 0 to 8 and is a best practice intervention specifically for the symptoms of ASD. Early intervention is important as it allows the child to develop important skills and reach developmental milestones as early as possible. If these skills are not developed, however, the child may become frustrated and this may result in further problematic behaviors. Furthermore, neuroplasticity, the brain's ability to form new connections, is at its greatest capacity to alter the way the brain designs itself in early childhood. Therefore, in early childhood is the best time to learn new skills. Good practice intervention for ASD should be provided by a multidisciplinary team consisting of a number of health professionals, including educators, speech pathologists, occupational therapists, and psychologists. Be family-centered and consist of 15 to 25 and sometimes up to 40 hours of treatment per week. Implications for the effective implementation of early intervention from a multidisciplinary team includes the availability of experienced professionals and the waiting lists attached to these services, as well as the access to funding provided and costs of the private services. While anticipating funding and placed on waiting lists, many children with ASD are not receiving effective early intervention during the most crucial stage of intervention. As per the Good Practice Guidelines for ASD interventions, inclusive long daycare settings are a part of effective and best practice interventions. Inclusive education is the active recognition of the rights of every child to be included and the adaptation of the environment and teaching approaches to enable the participation and inclusion of all children in the school curriculum. Minimal support and education for mainstream teachers and early childhood education professionals creates a barrier to the successful implementation of inclusive education. Children participating in early intervention-based inclusive classroom settings saw a statistical improvement in behaviours, including temper and atypical behaviours, as well as improvement in social communication, mental development, self-help skills, daily living skills, socialization, symbolic play, and motor skills. Early intervention and inclusive classrooms are a part of the best practice guidelines for children with ASD. Early intervention occurs during a crucial phase of brain development and works best with an intense amount of therapy hours implemented. Unfortunately, the amount of healthcare professionals to provide early intervention for ASD has not increased at the same rate as the amount of children diagnosed with ASD, as early as 12 months of age. This results in extended waiting lists where children may not be seen until after the early intervention period is over. However, the use of paraprofessionals and early childhood education professionals to implement early intervention strategies into everyday classrooms is increasing to give the child the best start to life and learning during the most important phase of intervention. Therefore, early childhood education professionals are needed to assist in the implementation of early intervention strategies to increase the amount of early intervention a child is exposed to. This will assist children on waiting lists and their parents. An inclusive classroom is the best learning environment for a child with ASD and hence the best place for early intervention strategies to be implemented. Key points. Autism spectrum disorder is a term for a group of lifelong neurological disorders. Diagnostic criteria for ASD includes difficulties in social communication and restricted and repetitive behaviours from an early age. There is an increasing prevalence of ASD resulting in waiting lists. Early intervention and inclusive education are the best practice guidelines for ASD. Early childhood education professionals are needed to implement recommended strategies for children with ASD in an inclusive classroom to help close the gap between diagnoses and intervention. Autism spectrum disorder. Thank you. See you in Module 2.